So looking at the crowd, I've seen a few of you at other events, worked with a few of you, and so possibly you've heard, some of you have heard portions of this presentation, but I think you'll probably get some new information as well.
Yeah, I was just going to deviate from our script already. Are there people here who have seen a speech pathologist before? A few of you? That's great. I was looking for some friendly faces from Prince Albert, but it looks like I've got more work to do in PA to get them out to the Parkinsons Society education. So we're here to talk about what SLPs do to help people with Parkinson's. So that is speech therapy, voice therapy, and swallowing. So the majority of people who have Parkinson's will have some voice problems or some speech problems. And maybe you can relate to a few of these speech symptoms. Being not loud enough, that's a big one. Does that sound familiar to anyone? A hoarse or a scratchy voice, a shaky voice, maybe a monotone voice. Some people tend to lose their expressiveness in their voice. So the ups and downs of your voice that make you sound like you, sometimes that turns into more of a monotone voice. And it's difficult to express your emotions. So feeling happy, concern. That's one thing that we can work on. Slurred speech, mumbled words. It may be other people who might tell you, you know what, you're mumbling, or I can't understand you. Difficulty getting your voice started, difficulty getting your voice going. And you may have experienced maybe difficulty getting the feet going or getting the walking going. The same thing can happen with your voice. So difficulty getting your voice started. And some people experience fast speech. So speech comes out in fast rushes instead of slow, long sentences. I should have mentioned right off the bat, if anyone has questions as we go along, then jump in, because we're open to that. The first part we're going to do is the voice and speech part, and then we'll get into swallowing. So if you have anything that you want to comment on, or any questions to ask about speech and voice, you don't have to wait until we finish talking about swallowing. We can talk about it in the first half of the presentation. Justin, where was you?
All right, so, go ahead.
Are you from Prince Albert? You can. Oh, yes. This lady is from Prince Albert, and she wants to know how she can make an appointment to see a speech pathologist. So you can refer yourself. So that means you can call the therapies department at Victoria Hospital and say, I would like to see Heidi. Or you can go through your doctor. Typically, what I do before I start any therapy is I say, you should probably see an ear, nose, and throat doctor just to make sure before we start working on this area that there's nothing that might get in our way, no existing problems. So you'll probably have to see your doctor eventually anyway before we start therapy, but you can make an appointment directly with me. Yeah.
Does anyone else have any questions? We're really looking to try and make this interactive, which is why I'm standing behind the podium. All right.
Maybe you can talk about how people access speech therapy in the city.
So I think the process is pretty well the same for people that are in Saskatoon. You can refer yourself directly to, likely it's called the Adult Speech Language Center at City Hospital. And within the different health regions around the province, I'm sure you can directly refer to a speech pathologist. It might be a little bit difficult to figure out how to do that, but if you access their website, you're looking for rehabilitation or therapies or other links like that, and then definitely you can speak to your doctor. Okay, so,
This lady has a question.
sure.
Who's got a question?
The lady in the
This lady,
white blouse.
And then we'll get to you, sir, in a bit.
I want to know if there's anyone in the Regina area that can help with speech problems like mine.
She said she's wondering if there's anyone in the Regina area who does this kind of therapy. I don't.
I have a very soft voice, and I speak usually quite quickly, and my words get mumbled and don't know what I want.
So you're identifying with the symptoms that I just listed off. So
Yes,
those
very
you
much so.
recognize. Yeah.
Yes, but I'm wondering if there's anybody in Regina that can help me with them, because I've gone to the Wisconsin rehab, but their program is not really designed for this kind of thing. And I noticed that they seem to be designed otherwise.
I don't personally know any of the speech pathologists in Regina. You know?
I can't say that I do either. You did see an outpatient speech pathologist?
Saw someone at Wisconsin rehab.
Okay. Maybe we could talk to you after and see if we could help you track down the right information.
So other questions?
I think this fellow in the black had a question.
Does your voice not get weaker as you grow older?
A person's voice definitely changes as they get older. And Parkinson's disease adds another layer on top of that. But there are definitely things that can be done in both situations to make your voice better, if you're finding that it's not doing what you would like it to.
And this gentleman in red.
Actually, I can maybe help that lady out there a little bit. I do happen to know a couple of speech pathologists in the Regina area. If I can just get
Okay.
information from her. And
Sure.
You might know more than we do.
Entirely possible. Sorry, was there another question out there? Or?
I think my understanding is that only speech pathologists, that not all speech pathologists are covered by the SHSP or whatever it is. Is that correct? In other words, that it's the ones that work in the hospitals that are covered.
I'm not sure what you mean by covered. Trained to work with people with Parkinson's?
No, who the cost is covered.
So publicly funded therapy.
Yes.
Yeah, that's likely the case.
Yeah.
That you're looking for people that are in a facility.
So if you access speech pathology services at the hospital or through a health region clinic, then yes. But there are also speech pathologists who offer private therapy. And that could be covered if you have insurance of your own. So you'd have to access that money.
All right, so maybe I'll go back to the slide here that we've got up. Why do changes happen in people's voice when they have Parkinson's disease? And broadly speaking, there's about three different reasons. Sensory changes, being basically how well your brain understands what's happening with your body, how well it interprets how far things are moving, how fast they're moving, that type of thing. Because of those sensory changes, you probably think that you're making a big enough move. Your body's doing everything it needs to, but it turns out that you're not. And as far as the postural changes, I mean, everyone here understands better than I do the challenges that come from being in a somewhat stooped posture. Does that sound familiar? So as far as the sensory changes go, there's a few things that might change, and we're just going to be a little more specific here. I'm guessing that some of the things we're going to cover have already been covered in the presentation that was done this morning. But basically, how much effort am I putting in? That's one of the changes that may occur with Parkinson's. So if you're feeling like you're already putting in enough, because your brain is telling you you are, then why would you go about putting in more effort? Does this sound like a theme that you guys have heard before? Yes or no? Yeah? Okay. So we're just kind of adapting it strictly for voice. How much effort am I capable of putting in? Well, if you feel like you're putting in quite a bit of effort already, then it's going to be kind of surprising and difficult to put in more. And this, how much effort did I put in years ago? Because Parkinson's is can be slow moving, it's difficult to know, where was I 10 years ago? Where was I 5 years ago? Why is my voice just, when did it cross this threshold that nobody can understand what it is that I'm saying? For those people that have had some trouble with their voice, can anybody kind of pinpoint a time that they ran into some trouble? Like they just started to, maybe they were being asked to repeat a little more often. So I guess that might contribute to the kind of slow movement of the symptoms coming on. And I guess the last one, as far as the sensory changes go, are how loud am I? So all of these changes that I've spoken to up to this point have involved how much effort and movement am I getting out of my body? And this last one is more, what are my ears telling me? And that can also change. A person can feel like, even when they hear their voice, that they're getting enough loudness. And Heidi's just going to take over here.
So this is a diagram that I love to use, and if you've ever done speech therapy or voice therapy for Parkinson's, you might have seen this one before. So you'll see the person has all different loudnesses that are coming out of the mouth, very soft, normal, loud, and shouting. So what is typical for Parkinson's disease is the voice is between very soft and soft. Now, a person with Parkinson's may not realize that their voice really is that quiet. Sometimes it's other people who come to you and say, I can't understand you, your voice is very soft. You might not realize. So that's why I put those two blue arrows. How others hear you is quite soft, and how loud you feel you're talking, it might be that you feel you're talking at a normal loudness level. So do you want to flip that next slide? So Justin was talking about putting in more effort when you speak. So when you put in more effort, you might feel like you're shouting. And in therapy, people tell me all the time, I feel like I'm shouting, but I don't want to shout. And I said, when you feel like you're shouting, other people are probably hearing you at a normal loudness level. So it's difficult for your own brain to tell how loud you really are being. But throughout the course of therapy, of a certain kind of therapy that I do with people, we're bringing that awareness up, so you are maybe more aware that to be normal, maybe you feel like you're kind of on the edge of shouting. So this is a nice visual to keep in mind too, to think about, well, wait a minute, if someone's asking me to repeat all the time, maybe I need to slide those little arrows up so that I feel like maybe I'm talking too loud. But then no one has to ask me to repeat myself again.
Great. So we've talked about these sensory changes up until now, where it might be hard to trust the information you're getting on your own voice. Does anybody have any questions about that so far?
Has anyone had that experience where people ask you to repeat and
They're
ask
kind
you
of
to
better
repeat?
hearing me. Makes a difference too in me hearing my own voice.
Possibly, yes. It shouldn't make a difference in how much effort you feel like you're putting in.
Some other people need to hear me.
That's the
I hear the same thing over and over again. Well, my wife tells me that I mumble and I'm not loud enough, but she has a hearing problem. So then I say, well, between the two of you, you've both got some work to do, right? So do you find that with your hearing aid, you can hear yourself better? I see. You can hear yourself, but others can't hear you as well. So this might be a case where you feel you're being loud enough, but other people are hearing you quite soft.
So moving on from the sensory changes, we're on to some physical changes that can come about. So first thing that we have to do if we're going to talk, and stuff that we never really think about, it just happens. But the first thing that we've got to do is we've got to be able to breathe if we're going to talk. And just like every other muscle group involved in, or that can be affected by Parkinson's, the muscles involved in breathing can definitely stiffen up. So initially when we put this slide together, we thought that there was going to be other people in here who didn't have Parkinson's, but we'll see if we can modify it here a little bit. So I want you guys to take the biggest breath you can. And just go ahead and let it out. We'll pass it. Okay. Now I want people to kind of accentuate a stoop posture. So, and now it's time to take as big a breath you can. And did anybody notice any difference there? Tell me what you got.
It's a much fuller breath when you stand, when you hold your shoulders back.
Great. So everything just works a little bit better, or maybe a lot better. So not surprisingly, that's going to be a big part of therapy. Moving on to the voice box. When we're talking about producing voice, in our throat we have two vocal cords. They're supposed to sit beside each other, just kind of straight on, almost like two flags flapping in the wind. And as we age, they can curve a little bit, but Parkinson's disease can cause quite a significant bowing effect to the vocal cords, which means that as you're pushing air through, you're going to have less air getting kind of trapped by those flags or your vocal cords. And so it's going to take more air to get them through. And if they're bowed, also if you're trying to get them closer, they never really come together. I don't know if everybody can see this or not, but I guess I should come over here. Instead of being flat, they're sort of bowed. And it doesn't matter how much pressure you put in there, you still end up with a bit of a hole there. But people oftentimes use extra tension to try and squeeze those things together, squeeze their vocal cords together. And that can account for kind of this sort of vocal quality where you're really pushing hard. And has anybody experienced those symptoms when they go to get louder? So we've got 1, 2, feel like I'm at an auction. 3. If I was an auctioneer at all, I would try to liven that up a little bit. So with some treatment, we're looking at straightening those out somewhat, because those muscles have gotten used to just being quite bowed. As far as the articulators go, so tongue, lips, jaw movement, that sort of thing, they're also affected by being moved by stiff musculature. So again, this was going to be kind of designed for people who didn't have Parkinson's, but I mean, you guys can do it just as well. It'll kind of over-accentuate some difficulties you might have. I'd like you to turn to the person beside you, and I'd like you guys to have a conversation. Maybe you can talk about this lovely weather that we're having, and I want you to make sure that your lips stay touching when you're talking. Okay? How are you? Like this. And of course it's not going to go well, but I do want people to try it. And we can see all of it. So give it a shot.
I can't even do it.
So was anybody able to have a conversation? Like at any point at all? No. Okay. And obviously, that's not something that happens to that extent to anybody, but because the muscles involved in speech, particularly the ones involved in moving the mouth, are affected in Parkinson's, then a person's mouth just doesn't open as far. And so when you think that you're getting your mouth open enough and projecting your voice, it turns out that a lot of that sound is getting trapped behind your lips, and that can be a big part of the reason as to why people might have a hard time understanding.
I might add one thing to that. Sometimes I say to people, you might experience stiffness, rigid muscles when you walk or when you use your hands or your arms. The same thing is happening to all of these muscles as well. Stiffness and rigidity in your voice box, things don't move as well as they should. Or stiffness and rigidity in the muscles of your mouth as well. Your mouth isn't moving quite as much as it used to. So therapy would address that. And you might think that you're moving your mouth a lot, just like you might think that you're loud enough. But in reality, those movements have all gotten smaller. So then your volume goes down, and the clearness of the speech goes down as well.
Does anybody have any thoughts on any of this so far? Okay. All right, so we've got even more good news. So when we're talking about communication, so far we've really been talking about getting your voice up, making it clear, that sort of thing. Some of the other changes that may come about as a result of the disease, and again, you guys would know more about this than we would, but a few people I've worked with who have said, I just can't think of what it is that I want to say, or I can't keep these two thoughts in my head at once. I got to say this right now, and I don't have time to think about being louder. So that can definitely be an issue. I guess I've kind of addressed the word finding issue in there as well. And as all of you know, as you get tired, none of this works quite as well. So we are getting to a point where we want to talk about how we're going to help you, not just point out all these things that might not work as well. We're not here to paint a bleak picture.
Relating to finding words, what about when you're going to have a conversation and the words seem to come out mixed up?
So, wrong order?
Yeah.
Okay. So the question was, what about when you go to have a conversation with somebody and the words come out mixed up? Wrong order, that sort of thing. So that is something that I think is starting to get more attention. Up until this point, I think a lot of the research and treatment has been aimed at getting people louder, so we have some idea of what they're saying. And I think we're just starting to recognize that there's more symptoms than that, which is why a lot of the therapy that we aim for is making people, or helping people get louder, just having it be automatic. So they don't even have to think about it, so they can start to think more about the correct word order and that sort of thing. Does that make sense?
And do you find sometimes everyday life is so rushed? You go to the grocery store, you go to a restaurant or whatever, and everybody wants your response right now. And everything seems to move so fast, and people are impatient sometimes, and they can't wait for an answer. And sometimes all you need is just an extra couple of seconds. I printed off, oh, this lady has a question.
I find that I give up in a conversation. Everybody else is going so fast that I can't take in their idea and give out my own. So I just give up.
So the comment was that sometimes you just feel like giving up. In a group conversation, everyone else is going on so fast that it's too hard to take in what everyone else is saying and then think about what you want to say and then give your ideas. And that actually leads me right into this.
There you go.
Like for Parkinson's patients, we have mucus or we drool and saliva, and doesn't that impede your voice
So the comment was, you may have more mucus and you may drool, and that's part of the drooling is part of the maybe muscle weakness and rigidity. And people with Parkinson's don't swallow their own saliva as frequently. We can get into that in the swallowing portion, but you feel like it gets in the way of your communication. And it probably takes just a little bit more time to manage that and to say what you need to say. Part of dealing with this particular problem is educating the people around you, saying, you know what, I might just need an extra second, or maybe we can have this conversation in a quiet space instead of right here in the middle of everything that's going on. I brought this handout, and this handout is straight from the Parkinson's Society of Canada website, and it says effective communication in Parkinson's. And it's mostly tips for not the person with Parkinson's, but the people who are listening and communicating with them. Because communication goes both ways, right? So it's not just, it's not only the responsibility of the person who has Parkinson's, but it's also the responsibility of the person who's communicating with them to help make things a little bit easier. Give them an extra few seconds just to make sure that they can get their ideas out and say what they need to say before everybody else jumps in. Yes?
I watched Michael J. Fox last night on David Letterman, and he seemed to have to think about what he was going to say, and then all of a sudden he blurted out, and it would sometimes be a little garbled. So I wondered if that's kind of what's going to happen in the later stages to a lot of us.
That's definitely a symptom, a speech symptom of Parkinson's. So that blurting, like we call them fast rushes of speech. So it comes out really fast. That said, not everybody with Parkinson's is the same, and you all know that. So all of those symptoms that I listed before, mumbling, quiet voice, monotone, not everybody has every one of them. And not everybody's going to get every one of them either. So in the case of Michael J. Fox, he seems to have those short, fast bursts of speech. And sometimes when your speech is fast, we all know this, we can't make it clear. So if I'm nervous standing up here talking in front of all of you, and I start talking too fast, then I will trip over my words too. So actually that same thought applies to a lot of the things we're going to talk about today. Not every speech and swallowing symptom that we're going to talk about will affect everybody. So some people might have some of these and never experience some other ones. And some people might start to experience different ones as the years go on. Question over here.
Yes, I have found that it took me a few months or over a period of a year to let all my family and friends know that after 9 o'clock in the evening, I can't really talk on the phone or visit. And I'm sure a lot of you experience the same thing, but they know that now, and I really, if the phone rings after 9 o'clock, I know it's not family, it's probably a telemarketer.
That's a good strategy, explaining to your family and friends, you know, this is how it is for me right now, and you could help me out by not phoning after 9 o'clock, or by not trying to have an important conversation with me when there are 20 other people in the room. It just doesn't work for me that way, so we'll do it a different way now.
I find that when I push myself too much, by the end of the day, I can't communicate at all effectively. And what I've started to do more recently is use one key word for what I was going to say to get the attention of the person I want to get help from. So it might be like, what time is it now? And that's the question, but really all I say is watch. And then we know that I'm looking for the time. And I can see if we can get that one word at the end of the whole phrase.
Did everyone hear that comment? Using keywords to get your message across, just to save your energy. You know, you might last a little bit longer if you use a keyword instead of a whole sentence. That's another good strategy.
What do you think about sending texts instead of trying to talk?
Pardon me?
What do you think about sending texts instead of talking?
Oh, texting. That could be a good option. Depends how your hands are doing, right? Some people's Parkinson's symptoms show up in their hands. So then that might not work so well for them. But if your speech and voice are really affected and your hands are doing pretty good, yeah, whatever works.
Maybe one other thing I'd throw in here too, though, is just to be careful with that, because a big part of keeping the disease from progressing rather quickly is using the skills that you do have. I'm sure you covered that this morning. So you wouldn't want to just retreat to texting overall, but mixing them would probably be a very good idea.
I was going to say I watched an interview with Michael J. Fox, and they asked him about the way that he speaks, which is, you say sometimes that blurting. And really what it came down to is he tends to run at the higher end of his medication. In other words, he'd much rather be hyper and kind of blurted out than be on the other end. So he'll tend to run at the high end of medication rather than at the lower end, which tends to result in that kind of activity.
Sure.
That's an interesting point, because there are a lot of people who experience what we call on symptoms and off symptoms. So when you take your medication, then things start to go better, maybe walking is easier, talking is easier, eating is easier, and then as the medications, as it comes time for your next dose, maybe things aren't going as well. So looks like Michael J. Fox has found a really good way to sort of manage his, maybe he's up here all the time is what you're saying? Yep. And so that's one other strategy you can use. If you know that you're going to need to use your voice at a certain time, or you need to talk to somebody, maybe you can save that for a time when you really feel on and your speech is good.
As to that, I have a father who is 95 years old and lives in Ontario, and he has very hard of hearing, and I have Parkinson's. So I find that in the morning is the best time for both of us. And I wouldn't give up the phoning. It makes me very careful about what I'm saying and how I say it. And I think that it's a good exercise for everyone, like not to give up and just text, to just try to enunciate and get through to people.
I think our biggest message is pick your spots. So pick your spots where you're going to be successful, and then definitely really try. But if you know that it's going to be difficult, then maybe you do want to get that word out there that it's just not going to go as well during these certain situations.
And one other thing we should reiterate too, like you said, Justin, is, well, we tell people all the time, use it or lose it, right? So if we give up and we don't use our voices anymore because they're not really working for us, well, that decline is going to happen a lot faster. So the therapy that we do, we really use the voice. We use it a lot. Give it lots of exercise, and it's intense exercise. But it really helps keep those skills up and keep your speech up and help other people to understand it. We'll get into that. We'll move on to our next slide. Some people may be experiencing this. Sometimes all these changes add up, and of course, the person is more difficult to understand in conversation, maybe one-on-one, and probably in large groups. And so you kind of might not feel like doing all the things you used to do. Going for coffee with your buddies, or whatever it might be, singing in the choir. So it's easy to become more withdrawn. A person who is quite outgoing might just sit back a lot more. And the big risk here is social isolation. So I find if I can do therapy with someone and they can feel really confident about their good voice at the end of therapy, then they feel good about going out there and enjoying the things that they used to do. Get back into those things that you used to do.
I just need to ask, what time are we done here? Like, what time do we have until?
We did start a little bit late, so I'm hoping we can go a little bit late.
Yeah, so,
Yeah.
so we just wanted to demonstrate some therapy so people can have an idea of what they'd be getting into.
Yeah, so there are some different kinds of approaches to therapy, and they all have a lot in common. So Justin is going to be the patient, and I'm going to be the speech pathologist. I have my sound level meter here. Anyone seen one of these before? So this will tell me how many decibels that Justin is putting out there. So he would be sitting probably at a table. Do you want to turn your chair maybe a little bit this way? So this would probably be sitting at the table, and then we'd want to measure to make sure this this is picking up his speech from the same distance all the time. And I always watch here to see how many decibels he's putting out. So we're going to do one sustained ah, and this is how I usually do it. So I say, I'm going to do it first. Okay, do what I do. I want you to take a deep breath and then say ah as long and as loud as you can. So I'm going to do first. You can just relax. Okay, my turn. And I've gotten pretty good at this, so it might be loud. Oh, maybe I should cover this. Okay. Okay, we're going to try it again. Let's adjust a few things. Grab the edge of your chair here, and if you need to, you can really pull on that to get a better sound. Take a deep breath before you start and let all your air out. Let's try again. Louder, try louder. Open your mouth. Good, keep going, keep going, keep going. Keep going until you have no more air. Good. So then I would write down how many seconds he did, and I would write down how many decibels he got, and over the weeks we would continue to do this, and we'd see, oh yeah, the numbers are climbing.
Can I do one more?
Yes. So now we're hearing squeezing and pressing in the throat, right? We don't want to do that. We need to make sure we're doing this with proper technique, or we can cause other problems. So we can relax our throats and let the air out. Do a good one now. Justin can go pretty long. So that's one thing that if you decide to go for therapy, you'll probably be doing a lot of these. And therapy is kind of twofold. It's kind of like exercise, so your muscles are getting stronger, but your brain is also sort of resetting itself to know what loud feels like and to know what loud sounds like. So that when you go and you're talking on the phone with your sister, or you're going to the grocery store and you need to ask where something is, then you can use that loud voice. Is there anything you want to add to that, Justin?
No, I was just going to ask for questions. Anybody got any?
Yeah, go ahead. What do you pay for, or how much do you pay for speech therapy if you don't have it covered there? It's good for it.
That I don't know.
I think the going rate is maybe $80 to $120 an hour, something like that. I haven't checked lately.
How many sessions do you need to make progress?
Sure. So, in order to make progress and then be able to keep it, you're probably looking 15, 16 sessions. It's not cheap stuff. There may be a way to coordinate private therapy as well as public therapy if the public system can't offer the entire amount.
That's one of the challenges we have in Saskatchewan is, as far as I know, in Prince Albert, I'm the only one who offers a full program, publicly funded. So some other people are feeling the squeeze in other health regions. because it's an intensive program, you need lots of sessions, lots of practice, and sometimes the administrators say, you know what, we can't afford to have you working with the same person so many sessions in a row. We need to do some advocacy to make sure SLPs can do their job and get the results that we know speech therapy can give. So that's maybe the Parkinson's Society can help us out there and advocate for better services.
How many times do you have your people come back?
Me?
Yes.
I usually do 4 weeks, 4 times a week. So it's an intensive program, and that's why it works. And after those 4 weeks, then they're expected to keep going with exercises at home.
In Saskatoon, my experience was once a month for about 4 months, 4 or 5 months, but it was broken up by anytime the temperature was below 35 below, then there was no.
So for a total of about 5 or 6 sessions?
Yeah. Much less than what you do.
I'm fortunate to be able to do it.
Do you use a certain model for your therapy?
Yes, I do. So I'm trained in a certain type of therapy, and then I'm expected to deliver the therapy in exactly the way I was trained. There are other therapy models out there too, but I'm just trained in a certain one. And here we go. Lee Silverman voice treatment, that's the one that I do. And you can Google it, it's on the internet. And there's a lot of research behind it, so that it's easy to endorse that one because the research looks really good. But it does take a lot of clinic hours, which is something some health administrators aren't willing to allow. Other treatments probably look similar in a lot of ways, but we know that a good therapy program will have certain characteristics. So right at the bottom you can see daily practice is a really important one. So we say use it or lose it, so we got to be using it every day. And then practice in the real world. So a lot of my people, I say, okay, what are you doing tonight? You're talking with your sister on the phone for her birthday. This is your chance. You've been practicing your loud voice. This is your chance to really use it. Use your loud voice. So we practice in the clinic room, and then practice in the real world, and then practice with other people, you know? So it progresses to more and more sort of difficult speaking situations. The last one there is effort. So to get a good voice, we got to up the effort a lot. And some people end up giving more effort than they ever thought they could. That's part of my job, is to help people give lots of effort in their speech, because it's kind of like an exercise program in some ways. You know, if you're going to build your muscles, you need to be lifting more than little 1-pound weights, right? You got to be lifting more and giving lots of effort. So a good therapy program will be regular therapy sessions, regular practicing at home, homework. The homework is often using your good loud voice in a real life situation and using lots of effort.
Could you give us an example of exactly what your session would be? For example.
So what I would do, a person would come in and we do our ahs, you know, we do some of those. And of course, you know, when you go to the gym or something, you don't just do one, you do a lot of reps. So we do lots of reps of that. And then there's often some reading out loud, using that good loud voice. We do, what else do we do? We often do conversation. So near the end of therapy, I say, okay, we're gonna role play here. I'm the waitress and you're ordering from me. So practicing doing that with a loud voice, right? And then I send you home with a bunch of homework. So it usually takes 40 minutes to an hour to depending on how things go.
So we've got about 5 or 10 minutes left, and we do have quite a bit of stuff to cover on swallowing. Is that something people are interested in, or should we keep going with the speech? Swallow, okay, all right, here we go. These speech strategies, a lot of them are about pick your spots, and then make sure you have lots of effort when you are going to be serious about getting your point.
We spoke about these some already, and lots of the good ones came from you, so you already know about some of them.
So the reason speech pathologists are involved in swallowing is because it's the same structures involved. It's the same, we use our voice box, we use our mouth, we use the muscles that attach between the mouth and the throat. So that's how we're involved. And also there is some I guess, correlation between how well your speech is going